My apologies. Good afternoon, ladies and gentlemen, and welcome to the session. We're about to start, just trying to get the podium to be moved from the stage. Okay, they say innovation is what, there's a saying about innovation. I think while we wait for the microphone, I'll get us started. Once again, good afternoon, everyone, and welcome to our session titled The Socio-Economic Empowerment Policies for HIV Prevention Amongst Adolescent Girls and Young Women. We have a very power-packed panel discussion for you this afternoon. We recognize that we have quite a few speakers, and so we will first speak to the panelists, and time allowing, we will then move to a Q&A session. We are going to do things differently. I think many of you have been in panels where all the speakers have spoken, but I'll ask that all the speakers please start us off with just a brief introduction of who are you and why are you in this session. And I'll start from my far right with Dudu.
Good afternoon and thank you, moderator. My name is Dudu Simelane. I am at the SADC Secretariat. The reason I'm in this meeting, or this panel rather, is because it speaks to socio-economic policies and I work in the policy space. Thank you.
Good morning, ladies and gentlemen. I am Lebohang Mutai, the Chief Executive of the National AIDS Commission in Lesotho. As a leading and coordinating entity for the HIV response in the country and bringing together the multi-sectoral actors to play their role in protection of adolescent girls and young women, but specifically all the adolescents and young people in the country. Thank you.
Over to you, Joyce.
Thanks to me. Good afternoon, everyone. My name is Joyce Ouma. I work with the Global Network of Young People Living with HIV, commonly known as Y+ Global. And why I am here, I am a young woman from Kenya, and you're about to talk about the issues affecting us. Thank you.
Good afternoon, ladies and gentlemen. My name is Precious Shongwe from the beautiful kingdom of Eswatini. I work for the Network of Young People Living with HIV. I'm the acting national coordinator. And the reason I'm here, it is because I'm an activist and I'm passionate about issues of adolescent girls and young women. And I live and I breathe young people.
My name is Anne Githuku Shongwe. I'm here because my sister-in-law is sitting next to me. No. Well, I'm here because actually I come from a socio-economic or an economic background. That's my professional background. And so this is the work that I have been doing for many, many, many years. But really the opportunity to juxtapose the socio-economic context with that of HIV and adolescent girls and young women, I think, is an incredible opportunity that we have not had much of at all in the HIV discussions.
Thank you very much. And my name is Dumiko Manyane. I am the programs lead at Frontline AIDS and have the honor to facilitate this conversation. To start us off, when it comes to the issues of socio-economic challenges in the HIV response, we've heard the different submissions that have been made, both based on data, but as well as the stories we're hearing from communities that are represented here. And I'd like to first start off with you, Joyce. You come from a youth accountability space, and you work with young people in that diversity. And I'd like to understand from you, what do you think needs to be done to address the challenges that young women are facing in particular? And in what ways is this response supposed to be designed? Do you think we're getting there?
Wow, thank you very much to me. I think also in my introduction, I should have mentioned that in my work within Y Plus Global, I read various programs that are targeted at supporting adolescents and young people in all diversity, also supporting the youth-led organizations in different countries, especially in East and Southern African region. To answer your question, those are a lot. And I'll try to answer this from a perspective based on my programming experience. We always say as young people that we need to engage young people from the beginning all through till the end. And in practice, this has been easy for me because my organization is youth-led, actually led by young women, and part of the team that we are working with already knows what, in principle, we should be doing. So it hasn't been difficult for us to engage young people from the designing stage to the implementation and also to the evaluation. And I want to specifically talk about need-based programming and why we are trying as one of the organizations that donors have actually trusted to lead the response and also to engage young people. And I know I should be talking about young women because I mentioned that that is my forte, at least when I'm sitting on this panel. So one of the issues that I wanted to talk about is the sort of like the principles of meaningful engagement or ensuring that you are addressing the issues that are affecting adolescent girls and young women in accountability space and framework. The first thing is we have been working with young people, adolescent girls and young women as well, for co-creation and inclusion in decision making of what the project is, how are we going to address these issues that the young people they are bringing on board, and also if in any case we are not able to meet those needs, because sometimes the suggestions or the needs that the young people have transcend beyond what the donor expects. Sometimes the young person will tell you that I need school fee. And we get a lot of these on our info email address where someone will just reach out and say, hey, we engaged in this activity, but I'm stuck here. And how do we also try to help these young women to ensure that, yes, you're a young woman living with HIV, but you also need education. So these are some of the very hard conversations that we've had to sometimes try to bring up to donors. And to be honest, this has not been easy because even the donors, they have the targets and they have their specific deliverables that they need to look into, and the same also applies to us. So there is the need to do need-based programming, the need to address the intersectionality that young women present. I mean, I am here, I am a young woman living openly with HIV. I come from Kenya. I'm currently doing my master's level. All those things make me a different person in each of the situations that I'm in. And so when you're programming for someone like me, then there is need to provide specifically for the needs. Otherwise, I would not be going to a facility right now, for instance, to look for the dapivirine ring, and it's not what I need. Even though it's important for the other population, it is not what I need. So there is need to ensure that we are addressing young women, not just as a group, not just, because in this, there's two groups. There's adolescent girls, and then there is the young women. So there is need to ensure that we are respecting intersectionality and also respecting the contribution that the young women are making to our programming, and also ensure that they're engaged from the designing to the implementation and also to the evaluation and until the cycle begins.
Thank you for that, Joyce. I couldn't help but hear, already a clarion call around the need for diversified programming for adolescent girls and young women. And I think that is a brilliant segue to my next speaker. And you have a unique positionality. You come with an acute sensitivity around issues of economic empowerment, as well as the HIV response. And from you, we would like to know, do you think that economic empowerment is a vehicle to addressing some of the greater challenges around HIV in general? And in thinking about that, if you could also touch on, what are some of the unique positions that the UN plays, or structural provisions that are in place to address this, the poly-crisis that young women are facing?
Thank you so much, Tumi, and thank you for this conversation. I think it's such an important one. I think I'll say from the outset, you've heard a lot of data about adolescent girls and young women, and the fact that, in many of our countries now, we are seeing girls between the age of 10 and 19 are 6 times or 7 times or 8 times, even 11 times more infected than boys of the same age. So there's no question about the level and the depth of inequality that girls are facing, and it's young women and girls, and the data differs depending on a country and where you are, so that's one. The second one is that when you look at the socio-economic status of adolescent girls and young women who are living with HIV, their socio-economic status, and we have the data to show this, is lower than the socio-economic status of adolescent girls and young women who are not living with HIV. So there is obviously, it is a driver. The number of young women and girls who are engaged in transactional sex who are living with HIV are higher than the number of girls who are engaged in transactional sex who are not living with HIV. So we have the evidence to show us how great a driver of HIV the socioeconomic status is, right? So that's one. The poly crisis, I think, is such an important one. And right now in some of the programming, I don't know if Kenya is here, but Kenya has an initiative that they're calling the triple threat that is looking at HIV, GBV, and teenage pregnancy as these intersectional challenges that young women and girls are facing. But I want to share with you a framework that we've been developing as part of this inequalities agenda that we have been putting on the table, that to end inequalities, to end AIDS, you have to end inequalities. And so we've been thinking about what are the capabilities that we need to be able to confront the inequalities that young women and girls face. And there are 7 of these that I want to talk about. The first one is an inequality in the capability to live a healthy life. And that's accessing health services. That's being able to eat, to have what you need to have a healthy life. The second one is inequality in the capability to live in physical safety and legal security. So this is about safety and security. The third one is inequality in the capability to access knowledge. So this is about information and knowledge. The fourth one is inequality in the capability to achieve economic independence, right? So you may go to school, what happens thereafter? Do you have the economic independence to stand on your own 2 feet and not have to engage with transactional sex, for instance? The fifth one is inequality in the capability to have a secure living conditions, right? And we know how many young women and girls exchange sex for living conditions. The sixth one is inequality in the capability to enjoy individual, family, and social life and have self-respect. So this is about self-respect. And the seventh one is the inequality in the capability to participate in decision-making. So this is about voice, about influence, about agency. So if you think about these 7 capabilities, and then you look at the program for adolescent girls and young women on HIV, you might have a program that's a PrEP program, for instance, right? So the PrEP program only deals with part of the capability to live a healthy life. Unless it provides you with the physical safety and security, unless it deals with the economic capability, unless it deals with your living conditions and your agency, then you actually are unable to transform your situation and prevent HIV and be able to live a healthy life. So as we think about this framework, we've been doing more and more programming that is intersecting different programs. So we have Education Plus, which is an important initiative that looks at girls finishing secondary school, because we have evidence that when girls finish secondary school, it reduces their HIV infections by 50%, it reduces their teenage pregnancy by 75%. So then we add comprehensive sexuality education, so they know about their bodies. We add safety and security, which is about gender-based violence. We add access to sexual and reproductive health, which is about their healthy living. But we also look at school to work transitions, which is about the economic capability. Perhaps we need to think about the living conditions. We need to think about the agency. And there are other programs, and I know Jackie, who is here from UN Women, works with a very powerful program of Young Women for Life that's focused on decision-making, leadership, and agency, which becomes an important one. So how we develop programs that are intersecting in this way, I think is what is going to drive us and take us to that place where girls and young women are truly free and empowered. Thank you.
Thank you, Anne. And thank you for the applause. I actually just realized that I have not engaged much with the audience because I've really been following what the speakers have said. And it just strikes me that it's 2023 and we're still talking about the importance of investing through an intersectional approach when it comes to the HIV response. And it's a very interesting conversation because at the very same time, ICASA has become a space of being able to engage with donors and other development partners around how do we do development differently. And I also would like to take this moment to acknowledge my co-moderator who's just joined us. Welcome. I'll give you an opportunity to introduce yourself. And I'll also be handing over the reins to you after Melebohang. Welcome. Auslebo. Memote, you represent a National AIDS Council and an institution that is often seen as being pivotal, not only in policy making, but in terms of implementation of the various frameworks, including some of the work that Anne has graciously been able to describe in terms of some of the priorities that the UN has. We would like to hear from you. With all of this said, how is Lesotho responding to addressing the inequalities, particularly those that are facing AGYW in the country? And we also recognize that Lesotho has a very unique positioning in terms of its own socio-economic dynamics. And therefore, we are assuming that your response as a result will be suited for, this the work and the dichotomy between HIV and socio-economical issues. Over to you.
Thank you very much to me. Our slave was still okay. I've worked with young people so much that I always feel young at heart. They say lebza when they address me. Indeed, Lesotho is not immune from all the socio-economic challenges, and the young people in the country are also susceptible to any of the risks and vulnerabilities that are caused by that. But I'd also want to share that Lesotho, amidst all of those challenges, has indeed progressed well. And it is one of the 3 countries that throughout the week have been mentioned as those who have had a highest reduction of new infections at 74% from 2010 to 2022. Even so, we still experience about 80% of those new infections among our young people, and our adolescent girls and young women accounting for more than 50% of those new infections. So this says it is still an area that needs to be addressed. Lesotho has progressed with regards to the legal reforms. We have managed as a country to have the laws that are meant to protect women and girls, the Counter Domestic Act, the Counter Domestic Violence Act, the Sexual Offences Act, including the very recent one that is meant to protect the widows, the wealth of the widows, and safeguard those assets for the girls and the children in the family. And all of this in an effort to make sure that young people, and specifically girls and women, are able to sustain themselves. We have also been improving our economic policy environment, or an enabling policy environment in general, whether it's the laws and policies that are mandating the CSE to make sure that comprehensive sexuality education is taught across the education sector from primary level up till to the secondary level. And the school feeding policies, where we're saying every child must at least have a decent meal, even if it is while at school. So for all of these policies, which include for girls to return to schools after being pregnancies, they are all in support of our HYW. Lesotho has been implementing the differentiated, targeted, layered interventions that address both behavioral, biological, and structural factors that affect the young people. The adolescent corners, the adolescent health corners, which have done well to provide safe spaces for them to access and take up the services that are meant for them. And also a combination prevention, which would include numerous other approaches, the DSD models, for them not to have just one pathway to take services and access those services, but for them to have the different pathways at the spaces where they are comfortable and are convenient to them to access such services. I must say, we also do have a high political commitment through various programs that are pioneered and led by the Office of the Prime Minister, mainly to stimulate the youth engagement throughout the different sectors, socio and economic sectors. We have an apprenticeship program, which is mainly meant to pattern skills for the young people who have just exited the different levels of education and prepare them to join the workspace. There is a poverty reduction program that aims at providing the sheep to the head boys, so that they don't only provide a service of safeguarding those, but they also have those as their own capital and asset. And they are supported to make sure that even the next other group of the head boys is able to benefit from that program. These are the programs that are not only targeting the adolescent girls and young women, but also boys and men, to make sure that they are also part of the efforts that are meant to provide securities for the young women. There are a number of strategic partnerships that Lesotho has made sure that they exist to support these multi-sectoral actions that Lesotho is engaging in. The development partners, our CSOs at different levels, at the national, district, up until the community levels, to make sure that no one is left behind, girls and women, but again, men and boys. Yes, I do agree, and I can share that we still have those areas that we need to to improve. We still need to engage boys and men mostly. We still need a lot of investments in areas that will promote boys and men. We still need to make sure that our services are integrated for this target population, especially HIV, SRH, and some NCDC, including the mental health, which you have seen encroaching into this group. As NAC, we have currently launched a national HIV strategic plan, which basically focus on young people because they are key to the interventions that could be addressed. And we have included a forum of young people where they come together from different sectors, youth in employment and youth from rural areas, to make sure that there's a voice for advocacy, they're able to mobilize each other. And we have also improved data analysis where we triangulate non-biomedical data from non-biomedical interventions at community levels to make sure that all those interventions complement the health interventions that we have seen and have been successful in the country. I can say we have been intentional in engaging youth, we have been intentional to involving boys, because we do understand that the trajectory of the HIV response depends largely on how we respond to adolescents and young people. Thank you.
My name is Nyaradzai Gumbonjanda. I have the last 2 years of learning how to navigate the world of disability, and much more so disability when you have to work with girls and in the area of HIV. And my delay is just an experience that I've had at ICASA, that negotiating for ourselves as adults is a little bit harder as adult women, much more so for the little girls and the young women in our communities. I'm so happy and so excited to me and all of you to be joining you and to be joining the panel for this discussion. I know we have to continue with the conversations that we have, but to me, I want to hand over to you to continue, because I just want to tell. I ran a shelter, and this little girl came to the shelter, pregnant, like 9 months, gender-based marriage. She went into labor after 2 days, gave birth, HIV tested. The legal issue, we have to deal with the health issue, we have to find this girl somewhere to take care of, and now to take care of her and her child as well. So you can call me Gogo Tanyaradzwa, because at my shelter I have little Tanyaradzwa. I thought I'm just dealing with a case of child marriage and HIV, but I'm dealing with being a grandmother at a shelter. Are we ready, the National AIDS Councils and partners, to deal with the complexities? If she doesn't have social and economic empowerment to negotiate the legal issues, the social issues, health, sustainability, education, and her future. To me, continue the conversation, and I'll come back with the summaries.
Thank you. And I'd just like to say we hold space for you. The work that... Yes, please.
Randa, I am the Executive Director for Rosaria Memorial Trust and immediate past African Union Goodwill Ambassador on ending child marriage. HIV is part of our lives and part of my life and part of the life in my community. Back to you, Tommy.
Thank you so much. I was just saying we hold space for you, the work that you do, and all the adolescent girls and young women who are facing all these challenges on a daily basis. And what you've just shared reminds me of something that is a personal protest of mine, that I do not want to recognize child marriage as a terminology, because children cannot consent to marriage. Marriage has to be mutual, it has to be consented, and I sometimes find some of these technical languages that we use to be problematic in themselves. And I was wondering, as I hand over to you, Dudu, representing SADC and having this unique, I think I've said unique positionality 3 times in this panel. But SADC has that, uniqueness in that as a regional entity, not only do you inform regional policy making, you actually convene the policymakers, the ministers, when it comes to these issues. And we'd like to hear from you in terms of SADC's approach How is SADC responding to issues of adolescent girls and young women? And particularly, what are the driving factors for SADC to respond to the socio-economic challenges in the region?
Thank you, Tumi. I've been listening to the other panelists, the fellow panelists, and painting a picture of the situation faced by adolescent girls and young women, which would range from patriarchy to poverty to HIV infection to less autonomy and being left out of decision-making spaces, the issues that have to do with poor health outcomes and poor education outcomes. And these are the issues that, as SADC, we try to set policy in consultation with the member states to address those issues. In terms of the policy environment or our work around policy and how it would help to address some of these ills that have been spoken about by the fellow panelists, I must say that I do like the intervention from Lesotho because it speaks to actual work on the ground and what the Lesotho government has been doing. But let me speak on the part of SADC. At SADC, we have regional protocols and policies, and in particular, for this subject matter of today, we have the SADC policy on health, SADC protocol on health, but also the SADC gender and development protocol. And to address some of these issues that relate to GBV, SRHR, HIV, we have several strategies, some of policies and strategies, some of which you are already familiar with, our SRH strategy, but also our strategy related to adolescent girls and young women and key populations. On the poverty front, we already have a SADC regional multidimensional women economic empowerment program, which member states are implementing. And we are also, we have policies related to education and skills development. And I want to indicate here that when we talk of education, as Anne mentioned, we also want to position young women and girls in spaces which are uncharted waters, so to say, spaces such as STEM. We have a Women in Science Charter at SADC. We call it WIZETO, which is Women in Science, Technology and Mathematics. But also let me say that we also do have the SADC Gender and Development Monitor, which we use to track progress on the implementation of our SADC Gender and Development Protocol. So what are the key principles that we follow so that you are able, as the audience of this panel, to relate what happens at the regional level and what happens at the national level, just like Lesotho has presented. We develop these policies, but let me also add that even at the country level, when policies are being developed, it's important that these policies include all relevant stakeholders, such as young women and girls, which we are about today. There will be no point for governments to sit around the table and develop policies without these women and young and girls that we are talking about today, such as, for instance, in the issue of socio-economic policies. Number two, when these policies when they have been developed, we believe that member states are going to harmonize and align their national policies with the regional policies and vice versa, so that when we deliver the results, when countries deliver the results, they speak to the regional targets, for an example. We're all delivering together as 16 states, but looking or delivering against one key goal. So that's where harmonization and domestication comes in. And number three, I just want to talk about the issue of country context. We do know that countries are different, the situations are different, but overall, the situation is the same. Just as what Anne said, just as what the CEO of NAC Lesotho our young lady from Kenya. So some of the policies that we develop at the regional level will be adapted based on country context. So country context is important, and country ownership and country leadership. I think that's important for the part of government to be able to embrace and lead this the agenda of socio-economic development, particularly targeting young women and girls. We also look at the principle of variable geometry. As you know, we are 16 states. We might not agree on all issues at the same time, but that principle helps to say countries who really want to move forward without being hindered by any country contextual issues should be able to do so, and we support that, rather than having 16 countries trying to agree and one country having a dissenting voice. That we think is regressive. We have adopted this progressive principle of variable geometry, which allows countries who are ready to move forward with any reforms, whether it's legal reforms and also other reforms or enabling environment policies to move forward. So having said this, I think it's important, therefore, that as the regional level, we also have an appreciation of what's happening in the countries. But specifically, our role as a regional entity is critical in areas where, for example, countries are finding it difficult to move as individual countries. That is where the region plays a critical role, such as, for example, in areas that are seen to be contentious. We have our SRHR strategy. You can imagine we are very diverse as a region. Some are more progressive than others, but this strategy or any other policy, this is just an example, or any other policy could help to propel the region forward to the extent that if we were thinking of individual countries, you would probably not have seen the progress that we are making when we coalesce around a particular policy or a particular strategy, such as the SRHR strategy.
Thank you.
Yes.
Thank you, Melebo.
Thank you. I think that's what I wanted to say. But also, let me say this because time is running out and I won't have another round.
It's run out and we still have
Run
two
out.
speakers.
I wanted to talk about patriarchy, to say we will not rewrite the story of patriarchy overnight, because it's subtle and it's among us. We live with it as modern as we look and feel. But we can give women the ammunition to circumvent it. That's what I wanted to say. Thank you.
Thank you, and this is noted. A round of applause. Precious, I'll move swiftly to you. One of the points that Melebo raised was the domestication processes around policies, frameworks, and so forth. You have played a very important role in convening young people in Eswatini around different processes, be it the Global Fund, to make sure that young people are able to inform some of these strategic processes. Could you please share with us, what more do you think needs to be done?
Thank you so much, Tumi. And I just want, maybe before I speak, just to remind the whole house that adolescent girls and young women are not numbers, and they are very diverse. So every time when we sit and we do programming, we are not going to discuss numbers, but we are going to discuss living beings. And also, maybe to come from a regional point of view and national point of view, that the policies that are there at country level, the national frameworks, the national plans, and the implementation plans should reflect the priorities of adolescent girls and young women who have been involved in the country processes, like the consultations, including the girls and young women in hard-to-reach areas, because we have a tendency as donors and funders at the country level to call those that can pick a call or can get into a Zoom meeting, or those that are in the urban areas, and forget that the issues are very diverse, where you stay and the background you're coming from and where you are in life as a girl and a young woman. And so you would find that you would have Pressure sitting at a platform where pressures can't even influence or even speak for the needs of adolescent girls. So that you would find that by the time implementation comes, there's no funding that has been allocated yet. These are issues that we're talking about: new infections, we are talking about teenage pregnancy, we are talking non-adherence to treatment. But then when you come at country level, you look into the national frameworks. The national frameworks are not indicating any gaps, but then the reports and the data that are coming on the ground are saying there's an issue. And then they will tell you that money is here, but the money does not reflect the gaps that are coming, so we cannot divert resources to what is coming up now. But then the biggest question is, when the national frameworks were being developed and the national plans and the budget, where were the adolescent girls and young women when these were being developed? So that is why we are saying these are not adolescent girls and young women are not numbers, but these are beings which should be included in all the processes. I'll make an example of Eswatini, where we just had the GC7 consultation. The current grant that has been, that just went through at Global Fund level, the adolescent girls reflects the needs of the adolescent girls, because they have been there from different districts, even including their backgrounds. So whatever is happening now, the adolescent girls know that we're part of this process. We were sitting also during the grant-making process. And now we are going to be also sitting at the national level, where now the proposals are out. And as adolescent girls and young women, we will say, this is where we want our funds to go through, because we believe that when our money has been put here, we can have access. The programs that will be run according to what we need. And also governments have to be very deliberate when it comes to allocating funds at national level. Not only donors should always give us money at country level. I'd make an example. Every donor is talking about 2030. The question is, will HIV not be there 2030? Definitely, as long as there's poverty, we are going to have HIV by 2030. So one of the key things governments in the different countries have to clearly tell us how much are they investing when it comes to economic empowerment for adolescent girls and young women. And when we are talking about economic empowerment, here we are also including issues of gender equality. Yes. So this is very important, that we ensure that we also have accountability frameworks where governments are going to tell us how much was sent, how that money was sent, and what was the impact of that funds that went through. Thank you.
Thank you, Futi. And as I head over to Nyaradzai, I'd just like to also acknowledge one of our youth speakers who's online. She could not join us earlier, and now we're running out of time. But just to acknowledge that we did have another young person. Her name is, I can now find her name, Pindile Priska Maseko from Young Women for Life. And we would have loved for her to have joined us. And now handing over to you to please wrap us up.
Thank you so much. Can I share my 3 minutes with just a greeting from Pindile? It is a principle that when young women are present, whoever is managing the tech, can we just have her to greet us? We can get their video later in full breath, and we share with the whole of ICASA, but we must hear the voice of Pindile. Pindile, can you hear us? We love you, we respect you. Can you speak to us and greet us? This was the minute of the voice of Pindile, the silent majority in our communities whose stories we may hear, but may decide not to hear, even if they are saying their story. This is the story of Pindile. Let's give our girls and young women space and opportunity, even if it is very difficult to do so. So Pindile, wherever you are, we love you, we respect you. It was a political choice for ICASA to have this session. I call it a political choice because what is put on the high-level sessions, it's a matter of decision makers prioritizing the Pindiles. This is what ICASA did. And to the co-host, thank you so much for really negotiating to have adolescent girls on the agenda of ICASA. We can never have a prosperous Africa which is free and safe and able to self-lead if the daughters of the continent are bleeding, are dying due to preventable causes, including HIV. And today, at this ICASA, you've set the precedent that adolescent girls and young women will always be on the center of the HIV response on this continent and globally. Thank you so much and congratulations. From the panelists, 5 key issues. I know that I missed 1 or 2 presentations. There are 5 key issues just that I want to say in summary. It's critical to have the political commitment, but the political commitment must be translated into doable interventions that impact lives. Political commitment is expressed by the appropriate laws and policies at the national level, at the regional level, and at the continental level. Just like we have the ESA commitments and all. But they must be accompanied by the 3rd recommendation, resources. Not anecdotal, small little showers, but a huge flow of deep resources that reaches services in communities. So it's not just about resources. When you have the SADC meetings, we want quality and quantity and accessible, including our own resources, domestic financing. That has come up very strongly and very clearly. Fourthly, it has come up very clearly and very strongly that we actually need the science to accompany the intervention, but in a way that continues to put the social issues equally important. So treatment and medication is important, but what is equally important is behavior change and self-empowerment. That has come very solidly in the discussion. The last few points that I want to highlight as I summarize what I have heard, we need to reclaim that the issues we are dealing with are about human behavior. The issue around social norms and patriarchy is about human beings deciding how they want to behave. So it's achievable for us to behave differently, to relate differently, to resource differently. So that has been a very clear, that the accountability is on us, a very clear conversation around accountability. And lastly, that the young women and the girls are not just the subjects of discussions. They are human beings who are innovating, who are co-creating solutions, who are hustling, who are finding solutions for their own lives. They are not waiting for a savior from somewhere. They want us to meet them halfway. Let's do that. Let's resource the innovations, the creativity, the organizing, the mobilizing of adolescents and young women for them to be part of the solutions. My own last reflection, I want to see the little Tanyarads and the mother, that little girl at my shelter. I want her to go back to school. I want her to get her own income. I don't want the girls to drift on the margins of society in the urban slums because they cannot belong anywhere. We are rejecting our own when they have children. Empathy in leadership, responsibility in leadership, accountability in leadership. I've just been amazed by the hosts. I want to thank you all so much, our hosts who have put this program together, and for inviting some of the village women like me to come with our crutches, our wheelchairs, to ICASA, and to speak the voices of our communities. It has been a true honor for me and to me and the panelists to be part of this conversation. We are so seated here. I'm not feeling the pressure outside. Can you hear any footsteps outside? Can you hear them? No, we can't hear them. I can feel that we can borrow a minute. I feel always guilty if nobody speaks from the floor. It just feels not good, man. It just does not feel correct.
Yes, we're 5
Can I
minutes
just have
over.
one voice? Yes, please. Just to the point. Just speak your point. Yes, please. Speak your point and speak your heart, even with no microphone. In our villages, we don't have microphone. Yes.
Thank you very much. My name is Doreen Namialo Chaze. I work for Penal Reform International. Thanks to all our speakers. This session has been very interesting, especially the emphasis on diversity of the young people and also the need for intersectionality. Now, I work in a sector which is really working with children in conflict with the law, and I feel that what is missing in all our discussions are the interventions being made to support the adolescent girls in closed institutions.
Okay, my name is Mohammed from Kenya. Straight to the point, social media is confounding the inequalities and the lack of the capabilities we were taken through. So we need to come up with a way where we can bring it out. From the social identities, we may not even know who these adolescent girls are, because even from the social media, all girls have been to university, not just a university with Watersrand or New York University. Secondly, we are giving names to those GBVs and inequalities. So I think that's an area we need to deliberately focus on and bring it out. What is this language that the girls are bringing out so that we have effective interventions?
Okay, thank you. I was also worried about this session. So my name is Taya Monelisa Fombe, and I'm with Say What. And my question was on the policies that we have. Do we have programs that speaks to the effects of climate change on the lives of girls and young women, especially when we see that climate change is causing displacement, there is increased gender-based violence, and also when displacement happens, there is reduced access to HIV services. And also another comment was to say there is need for more male engagement when it comes to issues around gender-based violence. Thank you.